Hi ladies, welcome to Complete Midlife Wellness Center. I'm Dr. Susan, and I wanted to tell you a little bit about our health and hormone optimization visits and how that pathway works. All of us know by now that the traditional 15-minute doctor visit is far from sufficient to look into anything to do with our future wellness. So we want to offer you 3 hours of undivided time just for you, focusing 100% on what you need to reach your particular goal. So this truly is precision medicine, working on ways to look at where you are now, establish your goals, and to create a plan moving forward so that you can have the happiest and healthiest second half of life. We don't want to just live to be 100. We want to live as long as we can in the healthiest state, doing all the things that we love and not have a long period of decline where we're feeling sick and pain, unwell, all of those things in the last 20 years of life. Now we can set up a plan to make that possible or impossible. So together we're going to make it possible. So how does this work? Well, the very first time you come to see us, we're going to have a 30-minute visit with one of our very talented nurses or nurse practitioners gathering data about you to find out what you need. We're going to draw your blood at that visit, so we do recommend that you come in fasting. We'll do a very detailed lab panel looking not only at your hormonal status, but at lots of biomarkers that can help to predict disease, heart disease, diabetes, insulin resistance that we know a lot about now, nutritional deficiencies. We'll offer other tests that can predict whether we're at higher risk for things like Alzheimer's. So many tests are now available that can help to detect things that might be specific for you. We're going to do body composition on our InBody machine. We don't care what you weigh. We want to know how much muscle mass we have and how we can optimize that, because that particular piece of data is associated with so many diseases when it drops as we get older. Also see how much body fat we have and if we need to optimize that. Then we'll go through a detailed questionnaire looking at what you need, what your concerns are, and how we can address those personally for you. Different things like your family history are very much going to affect what you need, different than another person. Now once we've gathered all that data, then that will be your first 30-minute visit, and we'll have you come back in about a week or two once we've got all the results from those tests. Of course, if you need a mammogram, a pap smear, a colonoscopy, a bone density, or any other screening tests, we're going to order those for you and get those done. Now, when you come back, we're actually going to allow 90 minutes for the second visit. 60 minutes of it is spent face-to-face with your provider. Of course, it takes a little time to get checked in and checked out, so we allow that extra time so that none of it is cut short. You will have another hour of devoted time face-to-face looking only at you, and your provider will not be wasting time collecting data and information at that visit because we've already done it at the first one. That allows us to maximize your quality time with the provider at that second visit. So during that visit, she's going to go over everything. She'll have your lab work. We'll be going through that line by line, discussing what each of those labs mean and how to optimize them, because we don't want you to be normal. We want you to be optimal. And remember, those lab ranges are not optimal ranges. They're just reference ranges saying this is what people have in the community. We don't want you to have that. We want you to have the best optimal labs that you can have for you. So we'll create a plan. Might involve menopausal hormone therapy. It might involve certain targeted supplements, in some cases some pharmaceuticals depending on your particular situation. Some of our patients are interested in losing weight or gaining muscle or changing their nutrition or giving up alcohol, or many different things that might apply specifically to you. So we'll be talking all about that. We talk about sexual wellness, how to keep that part of our life alive, about sleep, nutrition, movement, stress management, so many things. So you can see why this takes a full hour. Well, then whatever interventions that we decide to do together at that visit, we want to see how they're working. So your third visit will be about 6 to 8 weeks later. We're going to visit again. We may do some additional blood work before that visit to see how things have changed, because of course we want to know if what we're doing is working. And then we'll go over all of that again for another 30 minutes. So within these 3 visits, we will have developed a comprehensive plan for you, and we will have seen you back again to see if it's working. Now, after that third visit, we're going to design a plan together to see how often you need to come in Some patients might come in as often as every 2 weeks if they're on a weight loss journey, or they might come in just twice a year if they're feeling great and we're just checking in to make sure that you're still feeling great. So that's what to expect on our health and hormone optimization pathway. During this time, you'll have access to your provider by email, to our clinical team by phone or email. We're able to connect regularly. We'll be sharing videos with you, information, making sure we're working as a team to keep you fully alive, optimal, really walking into the second half of life the healthiest that you can be. I can't wait to see you for your health and hormone optimization visit.